Medical bills are the leading cause of bankruptcy. As recently as 1981, only 8% of American families filing for bankruptcy did so in the aftermath of a serious medical problem. In 2001, that percentage rose to 46.2%. By 2009, that percentage rose again to 62.1%. Every 30 seconds, someone files for bankruptcy due to medical bills. Most medical debtors were well educated and middle class. 3/4 of them had health insurance. Why has this happened? First of all, there have been no cost controls on insurance companies. As you can see by the chart, the U.S. is represented in red. And since 1980, our cost controls have skyrocketed. They predict by the year 2020 that our costs will double. Another reason this has happened is because insurance companies use marketing techniques to cherry pick healthier, less costly enrollees. There have been no challenges to insurance company monopolies. There have been no control on drug prices, and our system provides care which is determined by ability to pay. What has been the history to change our healthcare system? In 1965, President Johnson enacted legislation which introduced Medicare. For the first time, retirees were able to get tax-based health coverage after retirement. In 1985, COBRA was enacted to give some employees the ability to continue health insurance coverage after leaving employment. Even though these changes were a small step in the right direction, it still wasn't enough. Millions of our citizens still did not have health care. So what was the American response to the problem of health care? In 2010, President Obama enacted the Patient Protection and Affordable Care Act. But what does that mean? When I went online to read the bill, I found that the bill contained 1,017 pages. So I decided to just sum up a few of the things. Starting in 2010, children aged 26 and younger will be able to remain covered under their parents' health insurance plan. Health insurance companies will be banned from excluding coverage for pre-existing conditions for children. Adults with pre-existing conditions will be eligible for coverage in high-risk insurance pools until further healthcare exchanges are up and running. There will be no annual lifetime limits or annual limits on coverage. There will also be changes happening in 2011, 2014, and 2018. But even with all the changes, there still will be no cost control on the insurance and medical industries. What has been the global response to the problem of health care? 32 of the 33 developed nations have universal health care, with the United States being the lone exception. Some of these countries have government-only health care, and some have universal health care provided by public and/or private insurance. Unlike the U.S., countries with private and public insurance do not allow insurance companies to make profit on their health insurance. Some of the countries who have universal health care with a single-payer system similar to our Medicare are Norway, Japan, United Kingdom, Kuwait, Sweden, Italy, Cyprus, Greece, Iceland, Denmark, Spain, and Bahrain. The thought of having a single-payer system in the United States definitely falls under the conflict perspective. Our capitalist system dictates that health care is a privilege and not a right. According to the July 21st, 2009 edition of the Washington Post, this mantra is backed up by lobbyists who spent $1.4 million per day to lobby against universal health care. So what do I think about health care? I think that health care is a right to all citizens. It is like eating. It is necessary for survival. Health care should not be determined by ability to pay. Our senior citizens or anyone should not have to go without food, should not have to go without electricity in order to buy their medication. I think for changes to occur, that all of us need to get involved. We need to become a we society instead of a me society. I've put up a few numbers so that you can help in the fight for universal health care. And you will need to contact the congressmen from this state at these numbers to tell them to do their job. We want universal health care. We need universal health care. Medicare for all should start from day zero. From the day you are born, you are covered. You have a right to health insurance. So you can contact the senator, you can contact the speaker, or you can even contact the president by going on www.whitehouse.gov, and you can email him and let him know that we want and we need universal health care.